this session is on social poetics of ethical visiting, and we've got the luxury of being able to record this separately from the conference because the record button wasn't pressed in time, which gives us the luxury of being able to do it in a much more relaxed way with more conversationally, which we had hoped to do from the beginning. So we'll move on. So we're going to introduce ourselves straight away.
So I'm Hibaq. I have 16 years of adult mental health practice in forensic settings and with learning disabilities. I also have a degree in psychology and I'm applying for the clinical doctorate again, hopefully.
And I'm Dawn. I've got 40 years of practice in child and adolescent and adult mental health, which includes 15 years of child protection social work. And in 2021, I started a new venture in adult forensics.
So our relationship to systemic experience, I'm part of a reflective practice team with Dawn, and I'm interested in further systemic training.
And I'm a family therapist, a systemic supervisor, and I'm a doctoral candidate in systemic practice. So we met in a newly created team to help those stuck in secure units to move out and live in the community.
And I've worked in forensic settings as a support worker, an assistant psychologist, and currently a social inclusion worker. And
in addition to that team, 2 days a week I was developing a forensic family therapy service with the psychology and psychotherapy lead. And I'm now seconded to this full-time as a quality improvement project. So in terms of our relationships to autism, I guess I would be called neurotypical, but I do not see myself as typical in any way, so that label doesn't sit squarely with me. And I've got members of my family both diagnosed and assumed to be autistic, and I worked with the autism in the child and adolescent mental health.
And I have a daughter with autism who doesn't classify herself yet. I'm also part of a community of parents with children who are autistic, and I have a little cousin who's younger than my daughter who's also been diagnosed with autism, and I'm really interested in the way that autism is expressed between boys and girls in particular.
So the plan for today is to explain a bit more about what adult forensics is. And when I find something difficult to express, I use poetry. So I'm going to use poetry to express something about my experience of entering this new field, using the idea of ethically visiting different territories as a counterpoint to the idea of hosting. So it's for us to be going out to people rather than then coming to us in a clinical setting. And we will focus on the experience of working with autism in forensic services and highlighting what we've noticed. So just a trigger warning, it's probably the worst nightmare to need institutional care. And in our experience, staff are generally well-meaning and do want to help. But institutions, as a way of managing the needs of large groups of people, do develop impersonal practices and misuse power to control in a colonising effect.
So what is adult forensics? It's usually when someone is diagnosed with a psychotic or affective mental disorder with an identified concern of risk to others. Some primary diagnosis of personality disorder is also considered if they're likely to benefit from treatment. And sorry, I was just going to say, usually it's a potential of risk of serious harm to others in relation to their mental health disorder.
Ethical visiting. I felt like a visitor to a faraway land. What are the customs, never stated, just assumed? A friendly face warned me, family therapists don't stay here. They get sacked or they leave, leaving me thinking, how long will I last? Are they waiting to see if I'll stay the distance or run a mile, scared of the task? Territories. No clinic, no base, no sense of place, visiting territories. Inpatient secure settings, keys, alarm belted to my waist. Too many protocols, contrasted with floating, unprotected, in the community. Cafe streets, parks, hostels with staff. Criteria to be forensic, major mental illness, usually psychosis, posing risk of violence, no mention of autistic. So many black men, big and dark complexions, growing numbers, recognised autistic. And when I use the term black, I'm talking about racialised and minoritised peoples.
So autism in forensic services, we know that diagnosis of autism is fairly recent. So a lot of clients have had years of their needs not being recognised or not well explained. There's usually stigma around this and years of a psychosis explanation over an autistic explanation.
And at least one person we've been working with has been stuck in secure services for over 40 years.
And we've noticed that challenging professional views is often seen as non-compliance.
There is the issue of institutionalisation, that it's a predictable life, and that for some people preferable to the chaos of being in the community.
And one of the major issues is sensory issues. It's, as we all know, in hospitals, it can be very loud, bright lights, lots of echoing, which can be difficult.
There's multiple meetings in front of many professionals.
And there's some poor professional understanding, for example, around the need for preparation for change, threats of harm not seen as an expression of feelings.
And the expectations in social interactions are confusing, for example, different professional perspectives.
And when we talk about racialized or minoritized black men, they're usually perceived as scary, threatening. You know, the terms aggressive are used consistently. They usually given diagnosis of psychosis rather than autism or personality disorder, which has an implication for treatment. They're regarded as difficult, making trouble, criminal. They're usually seen as invulnerable, and therefore stubborn. Their pride is often seen as arrogance and generally just needing to be managed, not supported.
So in terms of introducing systemic work, and I have been the only family therapist in the forensic system in the group of 3 trusts, and say Hibaq's very much a systemic thinker, the kind of conflicts between systemic thinking and the medical model, which is the dominating discourse really in this setting, create quite a few conflicts and approaches and misunderstandings. And some of these things are the difference between putting our whole self in, use of self-disclosure, seeing ourselves part of the process, that which gives a certain kind of accountability, and things like intra-related as well as interrelated. And we are doing with rather than doing to. And our approach that this could be me, so that sort of level of empathy. Whereas in the medical model, the professional self is seen very much as separate, and a kind of othering that goes on, a separation, doing for or on behalf of, and very much seen as criminals. So they're kind of ill and criminogenic. I don't even know what that term means, but it's used. And sometimes our transparency about methods and what we're trying to do sort of conflicts with a kind of secrecy in the medical model, where the aims are hidden, some kind of worry about what might happen if clients know what the plans are for them. And you know, we're trying to work collegiately and collaboratively, which incorporates differences in views. But that's seen as not really backing up colleagues if you're, especially if you can acknowledge difference in views in front of clients. And we see very much families as the experts of their situation, where in the medical model professionals are definitely the experts and know what should be done. And we try really hard to work with families, whereas in the medical approach, families are involved to support medical treatment. We'll embrace complexity, validating experience, seeing life cycle events and context is important, dealing with the effects of traumatic interactions and offering talking therapies. Whereas I notice a tendency in the medical model to want to simplify and classify and focus on symptoms. And that people's presentation is often not linked to the context that they've experienced. So, for example, we're noticing the impact of, say, a death of a parent, and that's not linked to actually suddenly things going a bit pear-shaped for that person. And they're seen as, having biological pathology. Trauma can be seen as an internal world, and see medication is considered the first line of treatment. And in terms of the multidisciplinary working, it occurred to me that discipline, just the name discipline has different modalities. I think that sort of says something. Actually, I got that from Foucault.
And there's competition of who knows how to work best with autism, and it's usually seen as a medical domain.
I think it's fair to say that both of our experiences of autism were discounted.
Yeah.
And I think there's the idea of what staff's role are, whether they're there to care or to punish, and they're very much, there is that sort of overriding thought that we do need to protect society, and think that probably systemic thinkers are seen as too soft in this regard, and not understanding that actually we are very much incorporating thinking about risk in our work, but because we're not doing it overtly in a way that's expected, it's seen as that we're not doing that enough.
And therapy is seen as a luxury and not prioritised, and certainly not prioritised in the forensic services.
And I think evidenced by sometimes your work can be stopped just without warning, all of a sudden, no regard for any need for any ending work or continuing linking work. So some of the examples of issues that we came across, there's many, but some of these are the ones that jumped out initially. So there's often the word inappropriate is used to describe people. What does inappropriate mean? A repeated accusation, often misunderstood, veiled perception it should be known, assumed, purposeful transgressions of personal and professional. Is it so wrong to love the staff, to see them as family, to harbour a fantasy? How else will we know if there has been sexual abuse if we stifle these feelings? So quite often, any sort of deemed inappropriate overtures to staff are very much sanctioned and not really understood that this might be a kind of communication.
Yeah.
Sorry, did you want to say something about?
Yeah, I was just thinking about the term inappropriate actually, and how sometimes it's become just a repetitive words to kind of use to describe when you don't really understand why somebody's doing something, or it's not going to be explored. Yeah. Yes.
Yeah, absolutely. And then there's a sensory overload, which I see sort of professionals contributing to. So what makes professionals exert pressure when the effect is to run away? Why do we shout when everything is too loud? And the other theme is these kind of logical inconsistencies. So why do professionals need clients to acquiesce? Don't you know autistics are clever, can spot flaws in arguments and can't let that go? Why can't we celebrate dreams of success? Why do we have to bring people down to earth? Whose earth? Don't you know autistics can do metaphor? Winning the argument is not the point. Needing to know, trying to understand, too confusing, too much contradiction, subdue. I was particularly thinking of somebody that's not been diagnosed as autistic, but was getting into trouble in meetings because he was talking about wanting to train and qualify as a doctor, as a social worker, etc. And I was thinking, we're not really there's no appreciation of the kind of wish or wanting to be appreciated for the level of intelligence, that you've got insights into what might be helpful, but that was seen as a challenge to the professionals in that meeting.
So just a few concluding remarks then, or hope for change. I like that. That we know that autism is being recognised much more recently.
And there are specialist support services advising teams, but I would link to Mary's presentation about the experts, and I think that does happen here, that who is the expert and what is expertise. I think personal experience isn't valued.
And there's generally more awareness of sensory and communication needs. This is, I guess, also I'm witnessing that in the wider community as well as in forensic services.
Yeah. And family therapy is growing and it is being respected in forensics. And clients I've found are really ready for this way of working. Families appreciate it despite the loss of trust in the professional systems.
And there's more service user and family and carer involvement.
Yeah, there are lots of initiatives out there, and
yeah,
peer support and payment for experts by experience.
Yeah.
And there's expectations to learn lessons from serious case reviews, and one's been brought to our attention recently of a man who had a repeated contact with accident and emergency services, and the bright lights noise would trigger a meltdown, and then restraint, medication, then out of that crisis would come off the medication and be okay, and then that pattern kept repeating, and eventually that person died. So for us to sort of recognise when we're seeing a meltdown from sensory overload, and to recognise it as such so that we can understand that better.
Yeah. And there's also other initiatives like anti-racist initiatives, equality, protected characteristics, which is, I guess, from my personal perspective, quite exciting.
Yeah, lots of pockets of stuff going on, isn't there?
Yeah.
And generally, I think the reduced stigma about being autistic pride, but just, you know, we have been working with someone who's very much doesn't want to be labelled as autistic, because of a kind of, he saw a program about autism and doesn't relate to the picture that he saw. And quite often people who've been stuck in secure services, they're in a time warp. They haven't really experienced how society has progressed and these attitudes have shifted. So there can be sometimes a need for support to bridge that gap, and that's not often really well understood.
Yeah, and I guess, Dawn, that had me thinking with that same person, it was the approach that was taken to during the process of diagnosis. And I think there wasn't really openness and clarity about the aims of what was being done. So I think that was very difficult, and probably a factor in denying that label as well.
Yeah.
Oh, is it me? And there's
if you want.
yeah, there's more acceptance of multiple identities and how this plays with intersectionality as well, which is
Yeah. So, and there's your references, so thank you.